talk about it all. So we're going to talk about menstruation in athletes. So the objectives, effects of menstrual cycles in athletes. That's number one. Number two is learn causes, risks, treatments, prevention of menstrual dysfunction. Different than the next objective. Because when we think about this, what's the only thing that we usually think about? Female triad. That's all we kind of just go to. I'll tell you most of the stuff what we all think about, right? It's just female triad and that's it. Notice the objectives are different. Learn a definition, cause, treatments of female athlete triad. Different. So, don't let this scare you. You don't have to memorize it. I will not ask questions about this. I couldn't tell you if you made me to. But I want you to look at it because we're going to reference it here in the next two slides because it's going to be interesting. So what I want you to notice is that where estrogen and progesterone are at their lowest, which is at that early follicular phase and late luteal phase. So remember, early follicular phase is actually during, I'm going to put it in quotes, when people are on their period. That makes it easy, yeah. Layman's terms. And then in the middle of the cycle is where everything kind of peaks and you get that ovulation, and then we go down cycle and then up again. So we'll go back and forth. I will go back and forth on this. So when you research the effects of the menstrual cycle on athletes, and this is, again, what does each phase affect? There is so much misleading information, and it's not very good. I went through tons and tons and tons of research, and everything says something different, whatever they wanted to say. For this swimmer, this is what we find. If we go through this runner, there's a lot of running and swimming, by the way, this is what we find. So I kind of found something that kind of generalized it, which made some sense. So we're going to go through each one of it because I want you to understand each cycle, and I'll go back and forth. So let's go with week 1, follicular phase. Remember, this is menses when they're on their period. So remember when I've talked before, what was the 3 vitamins I tell you that athletes should be taking? A, D, absolutely, whoever said it, thank you. Somebody was listening at some point. So again, vitamin D, omega-3 fish oil for anybody who's in like contact sports. Again, it's great for heart, brain power, all that good stuff. And then a multivitamin. But remember, I always say what? If you are a female, it should have a multivitamin with iron, because not every multivitamin has iron. This is why I always say that. So if you're looking at the follicular phase, this is day 1 through day 7. Again, I did not type this out, so there was multiple misspellings. Not me, just throwing that out there. It could be, but this one's not me. So it's estrogen's dominant, again, that part, but actually that's not right. It's estrogen's dominant, but it's low. But then possible cramping, feeling uncomfortable. So here's where they say cravings may increase due to discomfort. Really? Shocking. Okay. Might want to avoid jumping movements. I'm not really sure about that. You got to remember we're dealing with teenaged athletes a lot, and depending on when they started their menstrual cycle, also depends on what they are using at that time. And I will just be blunt, tampons versus pads. You have to understand that. They don't want to jump and move around as much because if they're wearing pads, it's not comfortable. They're not doing it right. They're not getting used to it. And if they had just started their menses, they don't understand it anyways. So it's uncomfortable. They don't know what's going on. So they're talking about sticking to strong, stable movements. They have increased tiredness. A calorie deficit is not impossible, but could be on that part. So then we go to week 2, which is that follicular phase. And I'm going to go back. So we're talking about the late follicular as you're starting to see that estrogen jump up and your, again, progesterone is also going up. I thought that was important to kind of go back and forth to kind of see because it makes sense. Now, you're talking about energy will increase, stronger lifts, best time to try personal best, adherence to calorie deficit should be easier. Week 3, luteal phase, so we go back. We're looking about that, again, early luteal phase, mid luteal phase, you're seeing that progesterone kind of really peak. So that matches here. Metabolic increase to 100 to 300 calories per day. They said to increase that because of this. You're starting that ovulation. Again, that endometrium is trying to kind of get thicker and about to shed. So you're trying to increase stuff. So of course you might need increased calories for that. Aerobic exercise could help with headaches. Then we go to week 4. We're talking more about focus on more quality of movement, not quantity, higher risk of injuries during this time. Various machines over free weights, and then use maintenance calories on this part. So this is one aspect and kind of what you would see in multiple studies all around. But then I went ahead and found another one and said, okay, let me compare. Again, they're talking about, let's show that week 1, that menstrual phase. Hormones, ideal peak performance, eat iron-enriched foods, totally makes sense. I totally get that. Eat anti-inflammatory foods and manage the menstrual cycle symptoms that they are getting. Now, interesting, if my pointer works, I don't think it does. If it does, no, it doesn't. Go back to that 28, like day 26 to 28. Did y'all see that? You will see that a lot of the symptoms happen days before. So when you talk about managed menstrual symptoms, you want to be managing those back at 25, 26, 27, 28 beforehand. That's when they're going to really need that Aleve, that NSAID, those things to manage the symptoms. If you're managing them during, you're late in the game because you can't control that. Follicular phase, pain threshold increases, optimal performance and energy. So we're really looking at after menstrual cycle. The research was showing that's when your optimal performance is going. Again, I know all the questions you're putting in your head right now, and I'm going to answer them because I'm with you. How in the world am I supposed to know when my athlete is where? And the 500 that I have, are you kidding? And females, they could be moody 28 days of the month, 30 days of the month. How am I supposed to know when their peak performance is? And how am I supposed to make sure that they're optimizing that for their workouts? I'm getting it. I'm reading your mind because I said the same thing. I'm like, yeah, right. Like, how am I supposed to know that? But you kind of can understand some of these. So when you go to the ovulation, blood sugar unstable, focus on fats and protein. And we talked about that again, increasing that caloric intake when we're trying to get that. And then the luteal phase. And then remember, see that anti-inflammatory foods on that? Carbs are essential. That's that PMS stuff that we were talking about, managing that early. So I think that's important. It's a lot of information. There's no way you're going to know this with every single person. I don't even know it for myself. Are you kidding? I don't know. You can ask me any day. I have no idea. So what is the menstrual cycle phases and the effects on athletes' performance? So I looked over research, and I did a data analysis, and I found a great article, which I will put on here in a second. This answers all your questions, right? How am I supposed to do this? Well, studies examining objective performance using anaerobic, aerobic, strength-related tests do not report a clear, consistent effects of the impact of menstrual cycle phases on physical performance. They did a lot of studies. There were some that said, oh, it's a little bit here on running, or this on a little bit on VO2 max. Overall, it was minuscule, if anything, and nothing really, so it does not show that there's any changes. Dr. Stevens, you just talked for 10 minutes and showed me all this stuff. Really? But you kind of understand a little bit of the calorie difference, what they're feeling, understanding where they are, and maybe put that in the back of your head when you're struggling with that athlete for performance and how they're feeling. Because I will tell you, I don't think about it enough with my female athletes. I don't go, oh, where are, I need to remember they have a menstrual cycle and they get changes very quickly in hormones that men do not have. And we have to remember that when we're talking about recovery. We're talking about treating them even just for the day and their moodiness, but again, understanding that. not just blowing it off and saying, oh, it's a teenager on that part. But here, remember, we are talking about teenagers. I'm a female, so I can say this, and moody ones, because I have the right to be. Did you see all those changes? So, here we go. Effects of athletes' perceived performance. This is in this, again, multi-study. Studies examining perceived performance consistently report that female athletes identify their performance to be relatively worse during the early follicular phase and late luteal phase. They're not wrong. Whenever we talked about this, early follicular, athlete is on their period, and late luteal phases are when estrogen and progesterone are at their lowest. There was a reason I kept saying that and showing that to y'all. Because your athletes say, I don't feel good. This is affecting my performance. Even though statistically and performance-wise, it's really not, but they perceive it that way. And that, as you know, will affect their performance. That's your next talk in a second, in case you're wondering, but you'll get that. Any questions so far on just the menstrual cycle and their phases and how it affects? Because those two slides tell you everything. Nothing on that one yet? So I'm going to move on to the next one, is dysfunction. Yes? This is great. So if they're on a pill to regulate, you're still going to get those phases through because the pill does this. The pill changes your estrogen and progesterone. And then what it normally does when you treat somebody with oral contraceptives at a younger age, they have a weak break into those hormones. So it follows that to a T. Now you can actually really look at what week they're on and what they're doing, because you'll know exactly where they are in that cycle phase and how to adjust it. So great question. Oral contraceptives helps tremendously regulate all that. There's no question. Like everybody else, you're like, ooh, where are you? So no, this one you know. Yes, ma'am. So that is a great, I've seen some of that talk, but again, the same thing the research is showing, they can't, it's so hard, and that's why I said, I wish I would have done this talk maybe 10 years ago. That was not me. Okay, just making sure. I wish I would have done this talk maybe 10 years ago because I would think about this a little bit more and to ask that question. We don't know, because us as physicians are really bad if we're not in research, which I am not, to ask my female athlete when she gets her ACL, I'm so worried about her ACL. And the same as y'all, right? I didn't stop to ask, where was she in this? Where was she in her cycle? Where was she into this component? Because there's interesting research, again, if you're talking about ACLs, lower extremity injuries with concussions, coming out of concussions. There's great research on that. But, that one's a little bit easier because you're coming off of an injury and going into a different one. I haven't asked. And I think a lot of physicians aren't asking unless you're in that type of research component. And I think it's hard because that is the number one thing that we're missing here. All the data shows is that we need more data. We need more research. Everything said that. The bottom line is with this, we need more research on it. More compatible data. Yes, whoever raised their hand. Have fun with that. How was your last 2 months on that? No. So it's definitely interesting. So, there has to be something with, again, the fact that they're on their period and you're knowing your estrogen and progesterone is at your lowest, does it make it weaker into the ligament component? And do you lose some muscle stability with estrogen and progesterone? These are we're coming up with all sorts of questions. Again, where is this? Because the laxity, we could argue, right, is either protective or is going to hurt us. But what we really need is the muscle strength. So my perception, especially when we're dealing with ACLs all the time, is that you're losing muscle strength. and muscle power when that estrogen and progesterone gets lower. So you lose your internal bracing, and there you blow your ACL. So this is all the research that needs to be done. Great questions thinking about that, but how would we stop it? I mean, could you imagine telling coach, oh, she's on her period this week, I don't think she can play? They would shoot me. But yeah, but it's something that's interesting, how much load they were on that week, how much practice time that week if they're going into a major game, or if we're getting weaker and weaker without that, energy and hormone level to sustain muscle strength. That might be interesting to say. Do we change their practice load before a big game like that? Because I'm curious. So like Mike on that, when that week, post on that one, when those two girls, how was their training? I don't know if you remember this. How was their training week prior to that game? Okay. Okay. That was something, I was just curious. I mean, we're coming up with all sorts of research things going on. So now we're going to move from menstrual cycle phases to menstrual dysfunction. Now, menstrual dysfunction is a lack of regular menstrual periods occurring every 21 to 45 days. So in the population of younger teenagers that are getting their menstrual cycle, they are not on a regular 21 to 45 day basis until they've had consistent periods for 3 to 6 months. Because the first year, sometimes 2, they're all over the place. So they are not considered on a regular schedule until they've hit 3 to 6 months of straight regular menses, if that makes sense. Because they can go 1 month and then 3 months later have another one because they're trying to get there. But if you're on a regular menstrual cycle, it should be every 21 to 45 days. I will tell my athletes this: get an app on your phone, because they will tell me they haven't had a period in 2 months when technically it was 35 days. And I'm like, really? And then remember, it's to 45 days. A regular period is 21 to 45 days. So primary amenorrhea is not having a period by age 15. It's a little lax of that definition, because if your mother didn't get her period till 15, 16, then a lot of pediatricians will ignore it and say, that's a family thing, we'll wait and see. But technically, we say 15. Secondary amenorrhea is not having a period for 3 months in a row when there were regular cycles before. That's what we just talked about, the regular cycles before. That's the world that we live in. Secondary amenorrhea. If you know, and you've heard me do a physical, what is the one thing at the very end I ask every female athlete? Do you have normal menses? And that means you've had one every month and you haven't skipped 3 months. I always ask every athlete that walks through a physical. Yes, I do it in 60 seconds, but it does come out at the very last question. So, and then the boys one's my favorite. If you have 2 testicles and they're both down, they always look at me weird, but that's okay. And then I ask them if they have 3, and then they answered correctly. They're like, I have 2. I was like, that's what I thought. Just thought I'd ask. So, but it works. So amenorrhea is menstrual cycles occurring more than 45 days. This means that they're having periods all the time. They have a heavy flow. It's coming consistently. So that's something that's a little bit different. Not what we're talking about today. So menstrual dysfunction is any changes in normal hormone levels that can cause menstrual dysfunction, specifically in athletes. Now, this could be because of stress, overtraining, diet, weight loss, lack of sleep. You're changing your hormone levels that then change your menstrual cycle. All of us today. So, this is the one thing I think about consistently, and the one thing I wish you could take home. This red sentence right here. It is the amount of energy in to energy out. Simple as that. How much energy do they have in, and how much are they exceeding? So the amount of energy used by the athlete exceeds the amount of energy taken in through nutrition. So then they become in a deficit, and that affects their hormone levels. Easy as that. So the risks. Increasing how long, how intense, and how often the athlete exercises, but they don't take in their nutrition to deal with that. high intensity training, limited food intake, increased weight loss, and not enough nutrition to sustain activity or increased activity. Okay? Treatments, pretty easy. That's totally me on the left side, by the way. So, treatments, nutrition, education, therapy, exercise modification, and vitamins. Okay? A lot harder than the words on the screen. It's very easy to say, very hard for all of us to convey to our athletes, to have a chance to talk to them about that, to get them to open up. So it's our job to notice these things, to remember these risks. We're so just focused on our job, that what we do every day, and there's so many athletes that y'all see every day. This is an individual thing. This isn't like a team-wide approach, unless you're post and have 2 ACLs and the whole people cycle together, but that's a whole team approach. Go team. So, but these are the risks. Let me read them again. Because it took me a long time to go, I can easily write them. But for me to actually understand and talk to an athlete or a patient about it is a little bit different. And I do talk to a lot of patients about this. And I always use my bottom one. Do you have enough energy to sustain what you're putting out? And to heal. I always add that last part, because to heal is also part of it. It's not just to do the exercise, you have to have enough energy to heal afterwards. So, thinking about these things with your schools, with your athletes, having nutrition on board, maybe taking a part of your budget, which is, I know, not enough. But do we have those snacks? Because we don't know what a lot of these kids' home life is. And we also have kids that, we'll get into in a second, don't know what to eat or how to eat. So do you have that protein bar? Do you have a little bit of that protein shake? A little bit extra in your budget just to throw in a couple, so you know these athletes that are missing nutrition, you can help them and encourage them, because you know what? They listen to you. They love y'all. So you get that Fairlife protein shake, and you know what? I'm going to spend, $400 of my budget this year, and I'm going to just have for, even if you just said if it was for athletes I'm going to do my female athletes for this food, my male athletes for this, like they can, the hard bars versus a drink, whatever you need to do. Maybe this is something that we need to kind of carve out. How will that help us decrease injury rates, perform better? Exercise modification. Oh, I know. That's an uphill battle. You mean talking to a coach about that? Ooh, have fun with that. Sorry. I can write it on a piece of paper, but y'all can't. But how do we talk? But honestly, when y'all know this, I'll go speak to all of our coaches. I'll sit down with them. We talk about injuries, and I'll talk about modifications to coaches. I have no problem talking about it. If we're seeing a certain trend, I don't mind sitting my rear end in front of a coach saying, okay, how do we modify exercise in our training to get there? Vitamins, you know me, I just told you the 3. Multivitamin with iron, because I'm talking about girls right now. Omega-3 fish oil, helps with concussions. Vitamin D, bone health. All 3 is very simple, not too bad. Most of them all come in gummies, except for omega-3. Prevention. Get enough sleep. Encourage it. Teenagers in high school, college, they're not getting enough sleep. Well, neither are we, but that's okay. We have to encourage it. We need to encourage this more and more. Gradually increase activity and training, correct nutritional problems, maintain a well-balanced diet, and ensure appropriate energy consumption. Really talk about it. What are you eating before practice? What are you eating after practice? Encouraging coaches for this. So, who and when do you seek help? As y'all heard me say 1,000 times, right? This is a team approach. We are a family. We all do this together. And there's not one person that can do it alone. Ask for help. Your sports medicine physician, sport nutritionist, fantastic. Sports psychologist, have a great one coming up in a second, so you can ask her all these fun questions. Gynecologist, I need help sometimes with this. Sometimes if it's primary amenorrhea, I'm not a gynecologist. I need help, okay? And endocrinologist, sometimes PCOS, dealing with thyroid issues, things like that can affect menstrual cycle. I'm gonna have to get the help of an endocrinologist to help me with it. Trainers, coaches, it's all of us. Family members, that's the hardest part, probably, on all of this. These are easy. Referrals are easy. Parents getting on board with you on that part is sometimes the hardest. But ask for help. We're all here together. Any questions on menstrual dysfunction? So we talked about the cycles and how it affects athletes. We know how it gets off, and we're kind of the big cause of that, right? We encourage sports and athletes and all sorts of getting out and moving, but are we doing it in the right way to make sure that the nutrition and energy in to sustain energy out plus healing? Questions on this one before we go to the last one? Yes. Mm-hmm. Yeah. Thyroid. Mm-hmm. Yep. So the good news is this. Well, first and foremost, I'm going to ask this question because it's me, right? They did get a cardiac workup before that endocrinologist work. Oh. So first and foremost, no matter what, right? I mean, we'll go back to my ABCs of emergencies. Make sure that they get a cardiac workup no matter what, because that thyroid could be affecting that as well. And is that not WPW causing that? And they just happen to have this other. So first and foremost, if that happens, and I'll get to the question part, I promise, but make sure that there's a cardiac workup every time before they start going, oh, I didn't eat today. I've heard that at least 100 times in my office. I passed out because I didn't eat today. I'm like, oh no, cardiac you get, my friend, I don't care. EKG, that's all that's happening. But usually there's not a lot of studies that are showing thyroid dysfunction, either high or low, with food intake. But there's been a big, huge increase in anti-inflammatory and pain with thyroid. So just switching the types of food. But to get that iron up, that energy up, the problem is that they are usually increasing heart rate. So internally, they are burning more calories than they're used to because their thyroid's off. So the problem is just the amount of nutrition and the calories in to get there. And of course, if they're bleeding heavy, then they need a little bit more iron, but it's usually the amount of caloric intake than it is like the type of food. Does that help a little bit on that part? Because we have to remember that, like we saw on here, like the iron we know, I mean, that's pretty self-explanatory. You bleed out, iron goes low. That's pretty But when those different hormones change in how, and this is a good question, right? Y'all are making me think of all sorts of like I want to do research, but it's making me think that way. On thyroid, how does your thyroid hormone affect your estrogen and progesterone levels during that? I'm sure there's papers out there. I'm going to go research it now because that's not like I'm already started thinking about, okay, if that changes this, then what does my calorie intake need to change? Because is it lower than normal or higher than normal? Should those people be on oral contraceptives to regulate that a little bit better as they're trying to regulate their thyroid? That's a great question. But I think it's more calorie part than anything. I would start with the easiest part we can, right? Yeah, great question. Anybody else? Because I'm coming up with 5 of them in my head at the moment, but that's okay. Anybody else on that one? Okay. So let's go to the one that we always think about. But guess where most of our athletes live? Here. So please don't forget about menstrual dysfunction and the causes, the risks, the treatments, because we all know about this, if it goes, right? And sometimes, I'm raising my hand, I don't think about it enough. That athlete that comes to me with multiple stress fractures and I'm trying to deal with the stress fracture, the vitamin D and all that stuff, I will tell you sometimes I miss this. I didn't think about it. It wasn't on the top of my list of think about, like when I was in a room trying to treat them. Will I be changing my ways now? Yeah. Well, thank you again for making me do this talk, because I really need to put that back on the higher part of my list for those athletes. So I need you to watch this definition. It has changed over the years. If you were old like me, this was not the original definition. It's a complex medical condition seen in physically active women and girls that includes a spectrum of conditions related to 3 interrelated components. Here are your 3. Look at this screen. Low energy availability. I love that they changed this. Love that they changed this, because this is what I say all the time. Energy in, energy out, plus recovery. Menstrual dysfunction, but most technically amenorrhea, that we're talking about those 3 months. Okay, remember the definition. And low bone mineral density. These have changed over the years. This is the new current definition. I love it. I do like it. It's more broad spectrum. So, early identification and medical management is high importance, and as athletes with any components of the triad are at risk of serious complications. So when we talked about menstrual dysfunction alone, yes, there's some complications, but they weren't serious. This one just got jumped up to a whole different level. What are those? Stress fractures, eating disorders, osteoporosis that could last for life. Last for life. Reproductive dysfunction, cardiovascular disease, decreased immune function, depression, anxiety disorders, fatigue, and poor performance. Okay? And yes, I know that fatigue and poor performance is probably not the most severe or serious complication, but how that happens is a snowball effect to the other serious ones. So that's why I put it on the serious complications. Causes: less available energy for the body to function. Imbalance between energy intake and energy expenditure. I'll say it over and over again. That's why it's in there 500 times. So the treatment. We have to reverse the recent weight loss, either by increasing their energy intake or decreasing their movement. Very easy. I say that. Try to get your athlete to do that. It's a whole different story. Eliminate the deficit and resume menses. That's the only objective. But you have to do it naturally. I will answer all the questions that I know somebody's asking in their head right now. It has to be done naturally. You have to be able to actually do this by your increase of energy and increase of nutrition and then decrease of energy expenditure. Here's your question. Can't you just do that with oral contraceptives? If you need to reset their menses, just put them on oral contraceptives. I have this question a lot. People ask me this all the time. Parents, trainers, coaches, they ask me this all the time. Absolutely not. You are masking the issue, and it won't fix it. So right now, they were just focused on getting their menses back, but you didn't actually treat your patient. So they're used to produce menses, but does not change the factors at the body that led to the abnormal menstruation, as well as the low bone mineral density. So the natural goal is the resumption of menses and required to normal bone mineral levels by your estrogen and progesterone going like they're supposed to. That estrogen needs to be normalized to optimize the bone mineral density back to where it needs to be. Special points. once we have to be aware of, which I don't have to remind all of us, we're dealing with teenagers. This is hard. When you're talking about menstrual cycles, menstrual dysfunction, female athlete triad, we're dealing with teenagers. They're vulnerable, right? They are emotional a little bit more than as they get older. I question that sometimes. But they are. And these are athletes. Again, add a whole nother level of stress to it. Perfectionism, anxiety, we're seeing a lot of this increase. I'm sure your next talk will talk a little bit about that. I'm not the only one. You can I'll raise my hand. I have seen a huge increase. Anxiety, performance anxiety, depression over the last 20 years. In this business, it was different. It's different now. What is now enhanced by dysfunction, and when your estrogen and progesterone are not where it should be, it's hard to measure, but those effects are real. And we have to make sure, I could have fixed their menstrual dysfunction and probably helped out tons of other things, and I just forgot to do that part. That's why this is so important in our athletes, because we can actually improve so much things just by trying to talk to them about a whole different part. You have a stress fracture in your tibia? Oh, it's your second stress fracture? Instead of just focusing on that stress fracture, is going, okay, let me take 3 steps back. Let me ask these questions. Even if you're not a female athlete triad, remember, most of our athletes sit in the dysfunction world. We can improve that stress fracture so much quicker. Maybe even heal that faster by getting these levels where they need to be with their nutrition and how much we're putting out. Recurrent injuries and stress fractures, fatigue, disordered eating. Again, I put all the information on there. That low energy availability causes all these things. If you're thinking about it, it's a whole other topic. Transgender athletes. This is not that part. I can do a whole talk on that. But this is just about females that have normal estrogen progesterone levels in cycles. So, here are my references. This big one right there, the 2014 Female Athlete Triad Coalition Consensus is really, really good. That's excellent. And then the review article that's in here, The Impact of Menstrual Cycle Phases on Athletes' Performance, that it has a whole bunch of articles that were all together. It's actually a review of that. It's a data review. So that was really good. Questions? I think I got like 5 minutes. Yes. It's huge. It does work. I wish I had the stuff on me right now, but yeah, that'd be great. Yeah. There is that decrease. Yeah. If it's there. And the biggest thing is right now we're all thinking about how do we implement that into our practice? How do we implement that through our year? That's a struggle for all of us. And that, again, as I say every time, we're a team. Let's figure it out. This was a need. It is a need. So we can do it together. However we need to do it, we'll come up with a plan with our teams, with our schools, and we'll make it happen. But I think all of us, maybe even reminding each other that this is a thing, is going to be helpful. And y'all already started it. So again, I thank you so much for reminding me. As much as I love my OMM and teaching all hands-on stuff, thank you for taking me out of my box and making me do this talk, because y'all requested it. I say it again. Anything that y'all want me to talk about, I absolutely will. I hope this was a little bit eye-opening, not too crazy. I didn't want to put like phases up there and showing you what it does to this muscle or an exercise physiology, because I would be bored, y'all would be bored. I wanted the real stuff that we do every day. Because as y'all know, we talk to each other every day. We're in this together. And we've got to make sure we're making changes for these athletes. We cannot stop thinking about our females are just a little bit different than our male athletes. We've got to remember things that they are going through. We've got to remember what our males are going through, right? I have a whole other injury profile I got to look for them that I get causes emergency, right? It's just for males. We have to remember those things. And if we're doing it all together, we won't miss it. We can help more athletes as we're supposed to. So y'all are amazing. Like I say every time, I'll answer that one question 1 second. Yes, sir.